This video will discuss medical impairment assessment, covering its concepts, philosophy, and purpose. The contents of this video cover the concepts, philosophy, and purpose of medical impairment assessment. It will also introduce the International Classification of Functioning, Disability and Health, or ICF, including its model and how it is used for diagnosis-based reporting. Historically, medical impairment assessment has been part of social justice, providing monetary compensation. Impairment ratings are vital to ensure appropriate compensation and that workers returning after injury can perform their job safely. It also helps match a worker's abilities to a new job, preventing future injuries. The World Health Organization, or WHO, developed the International Classification of Functioning, Disability, and Health, or ICF, to aid in this process. The ICF is a WHO framework for classifying health and health-related domains. It recognizes that functioning and disability occur within a specific context, including environmental factors. The ICF is a standard tool for measuring health and disability at individual and population levels, and was endorsed by all WHO member states in 2001. It is based on the same foundation as the International Classification of Diseases, or ICD, and the International Classification of Health Interventions, or HE. The ICF uses specific categories, including body functions, activities and participation, environmental factors, and body structures. It also utilizes qualifiers to further detail the assessment, such as barrier or facilitator, capacity, extent or magnitude of impairment, performance, and nature of change in body structure. The ICF is a comprehensive framework for describing and measuring health and disability. It covers health and health-related domains like body functions, structures, activities, and participation. These domains are viewed from body, individual, and societal perspectives. The ICF provides a standardized language and structure for understanding health and disability at various levels. The ICF model illustrates the relationship between a health condition, body functions and structures, activities, and participation, along with environmental and personal factors. It shows the flow from impairment to activity limitation to participation restriction. The ICF model reflects the dynamic interactions between an individual's health condition, environment, and personal factors. Impairment, activity limitations, and limitations in participation are not synonymous. An individual may experience a permutation of these factors, like having an impairment but still being able to participate in a relevant life situation. The model distinguishes between impairments, activity limitations, and participation restrictions. These three components are related but not synonymous, as an individual's experience of disability varies based on how these factors interact. This holistic approach allows for a nuanced understanding of disability beyond just a medical diagnosis. Body functions are the physiological functions of body systems, including psychological functions. Body structures are anatomic parts of the body. Activity is the execution of a task or action by an individual, with activity limitations being the difficulties an individual may have. Participation is the involvement in a life situation. The body functions classified by the ICF include mental functions, sensory functions and pain, voice and speech functions, and functions of several body systems: cardiovascular, hematological, immunological, respiratory, digestive, metabolic, endocrine, genitourinary, and reproductive systems. It also includes neuromusculoskeletal, movement-related functions, and functions of the skin and related structures. Body functions are the physiological functions of body systems, including psychological functions. Impairments are problems in body function or structure as a significant deviation or loss. The ICF provides broad percentage ranges for quantifying impairment. For example, moderate impairment is generally up to half of the scale of total impairment. For uniform quantification, assessment procedures need research development. The activities and participation component includes learning and applying knowledge, general tasks and demands, communication, mobility, and self-care. It also covers domestic life, interpersonal interactions and relationships, major life areas, and community, social, and civic life. Activity is the execution of a task or action, with activity limitations being the difficulties an individual may have. Participation is involvement in a life situation, and participation restrictions are the problems an individual may experience. The domains cover the full range of life areas, from basic learning to social tasks. This component denotes either activities, participation, or both. The activities and participation component uses performance and capacity qualifiers. Performance describes what an individual does in their current environment, including environmental factors. Capacity describes an individual's ability to execute a task or action in a uniform or standard environment. Both qualifiers can be used with or without assistive devices or personal assistance. Body structure refers to the anatomical parts of the body. These structures include the nervous system, eyes, ears, and related structures, as well as structures involved in voice and speech. It also includes the cardiovascular, hematological, immunological, respiratory, digestive, metabolic, endocrine, genitourinary, and reproductive systems. Additionally, it covers structures related to movement and the skin. Environmental factors include products and technology, the natural environment, and human-made changes to the environment. They also encompass support and relationships, attitudes and services, systems and policies. These factors are external to the individual. The ICF Contextual Factors Framework includes environmental and personal factors. Environmental factors are external, such as the physical environment and social support, and can act as facilitators or barriers. Personal factors are internal traits, like age and coping styles, and are not explicitly classified in the ICF due to their wide variation. Contextual factors are vital for understanding an individual's functioning within their environment. Facilitators improve functioning, such as assistive devices. Barriers limit functioning, like inaccessible buildings or negative attitudes. The ICF framework shows that functioning is an interaction between the person and their environment, not just their health condition. Personal factors include gender, age, other health conditions, coping style, social background, education, profession, past experience, and character style. Environmental factors include products, close milieu, institution, social norms, culture, built environment, political factors, and nature. Diagnoses-based impairment classes range from Class 0, indicating no objective problem, up to Class 4, which represents a very severe problem. Class 1 is a mild problem, Class 2 is a moderate problem, and Class 3 is a severe problem. The 5 impairment classes allow for rating patients from no problems to significant problems. Diagnosis-based grids were developed for each organ system, using consensus-based criteria. The final impairment rating may be adjusted based on factors like physical findings, clinical tests, and functional reports from the patient. The ICF also details domains of personal functioning, visually represented here. These domains cover various aspects of daily life and abilities that contribute to a person's overall function and participation. The domains of personal function include self-care, which covers activities of daily living, or ADLs, and instrumental activities of daily living, or IADLs. Mobility is another key domain, encompassing transfer and ambulation abilities. Activities of daily living, or ADLs, are basic self-care tasks. The 6 basic ADLs are eating, bathing, dressing, toileting, mobility, and grooming. While basic definitions exist, adaptive equipment may be used to increase independence in performing these tasks. Instrumental activities of daily living, or IADLs, are complex daily tasks necessary for independent living. They require higher cognitive and organizational skills than basic ADLs. Key examples include managing finances, transportation, meal preparation, housekeeping, medication management, and communication. This image represents a diagnosis-based grid, which organizes different health conditions or diagnoses into the 5 impairment classes to facilitate consistent impairment rating. Diagnosis-based grids are organized by organ systems and use standardized criteria to assign an initial impairment class. This systematic approach ensures that the medical impairment assessment is consistent and grounded in medical consensus. The grid structure provides a clear framework for relating specific medical diagnoses to a corresponding level of impairment severity, from Class 0 or normal to Class 4 or very severe. This concludes the discussion of the fundamental principles of medical impairment assessment, covering the ICF and the use of diagnosis-based grids. We now move to preparing the reports. Documentation is critical in the medical impairment assessment process, requiring thorough organization and attention to detail, as depicted in the visual. The whole-body approach to impairment ratings follows a hierarchy, where distal values are subordinate to proximal ones. The impairment rating cannot exceed the value assigned to the body region. Refer to Section 2.2b and Figure 2:1 in the 6th edition. For the clinical evaluation, review medical records beforehand and clarify inconsistencies. The physical examination must be consistent with standards. Encourage full effort if inconsistent effort is observed, and document extremity examinations bilaterally. Measurements must be reproducible to be valid. The analysis of the findings should discuss how specific results relate to the diagnosis and maximum medical improvement. Refer to the patient's current activities of daily living. Explain any absence of pertinent data and how the rating was determined with limited information. It is required to discuss how the impairment rating was calculated. Provide an explanation of the value, including the reference, page, and table number. Combine impairments and explain the basis for the final rating, and provide a summary list of all impairments. Thank you for watching this video on medical impairment assessment.